Hi, my name is Dr. John Andrea. I'm a family medicine physician here at Blackstone Valley Family Physician Group, and I also have a special interest in sports medicine as well. I'm a doctor of osteopathic medicine, or DO, so that's a different med school path, basically, where we get trained more in thinking of things holistically. So it's a very common path for people who want to get into primary care. What I enjoy about primary care is it doesn't stop there. There's follow-up. I like the continuity and being able to see the whole spectrum and not just one appointment at a time. It's more of comprehensive. The patients I see most often are maybe a little bit older, former athletes, or just want to stay active, or are struggling with certain pains or joint aches or arthritis and things of that nature. I cover a lot of sports, meaning I was a sideline doctor for football at high school level, at college level. The most common thing I would say is actually arthritis. So it's not necessarily acute injuries, but it's chronic or distant history of injuries and aches and pains and things that may not have a sports relation or injury, but they're people who want to stay active or are struggling, and they have medical problems, diabetes or high blood pressure, where they need to stay active and they can't because they have some joint arthritis or some joint issues. That's probably the most common thing I actually see. A lot of things that I see that are even with the athletes aren't injuries, they're illnesses, they're concussions, I have diabetes and I want to stay active. How do I do that with my insulin? As a family medicine physician, I think it's important to be involved in the community, and so what's important to me is that I become involved here and help the community that I live in. And so my goal is to establish here, see new patients, and develop connections that way.